All right, I asked and you guys answered. This was a question that was basically posed to say that what is the number one thing that you did to get healthy? I got more than 2,000 responses to this, and I think some of the answers to that will be of great interest. Now, again, this isn't research data. This isn't, something that has sort of been looked at by the experts. This is what's happening in real life, what people actually say happens that's made them feel healthier. So it's quite interesting to see the various results. So I've got 8 of them. I think some of them will be very controversial to say the least, particularly the last one. Stay tuned and take a listen. Coming in 8th place, and this will be sort of controversial, I suppose, stop listening to their doctor. Absolute sort of criticism of allopathic medicine and how it has let down so many people to the point where many of them say, hey, the best thing I could do is stop listening to my doctor. To me, that is shocking. The healthcare industry has to do a better job with this. In many cases, it is warranted. I think physicians have let a lot of people down with their medication first strategy, the pill for every ill, the chronically medicating symptoms and not ever going after the actual cause of disease, not trying to cure people. I think that is what is driving this. The number 7 one, which kind of actually surprised me a little bit, most healthy thing people said they did was to quit smoking. I think the decision not to smoke is incredibly important. But I mean, the reality is we don't have that many people that smoke anymore. I think it was 1954, about 45% of the population smoked as adults. Now that number is closer to about 11%. There's just not that many people that smoke anymore, so there's less people that have to quit smoking. So I think that's why that occupies just the number 7 spot. Coming in 6th place, and this one actually surprised me a little bit because I think in many ways it's one of the more important things, exercise regularly or to start exercising. To me, exercise personally has been one of the most impactful things I ever did in my life. I started exercising as an 8-year-old kid, started weightlifting when I was 13. I'm now, soon to be 59. Basically 50 years I've been physically active in training, and I think it is one of the reasons I'm able to perform at a high level physically and mentally because it impacts your mental health as well. So I think to me, exercise is a tremendous tool. I wish more people would do it. I'm trying to encourage people to take that up, hopefully by fixing the other aspects of your health, you're able to do it. I consider it a privilege. I literally look at it as a chance to improve myself, and I do it as frequently as I'm able to. It's one of my favorite parts of the day is getting in the gym and just pushing the body. I really enjoy this stuff. Now, at number 5, intermittent fasting or time-restricted eating. This is where you kind of spend a longer time throughout the day fasting. So you might eat in a total of 8 hours. A lot of people use that strategy where they're 16 hours fasted, 8 hours eating, or any version of that, maybe 4 hours consuming food and then 20 hours fasting. For many people, that is a incredibly powerful tool. Honestly, I don't think we're designed to be eating continuously. We're not grazing animals. Okay, number 4, people saying that they cut back or gave up sugary foods, ultra-processed foods, and seed oils. That was kind of the combined category there. And I think for many people, that is perhaps the number one thing that a lot of people do. You have to realize that my audience may not represent the general populace, but cutting out these foods that are, number one, hyper palatable, often addictive, and they have negative effects on the body. There is a plethora of information that would suggest that consuming a large part of your diet from that stuff is detrimental. And I think we see it in the population. We see so many people that are sick and suffering, so many people that apparently are addicted to these types of food. And giving these things up has a tremendously beneficial effect, particularly if they started out in a sort of health compromised status. Okay, the number 3 things people said they gave up alcohol. Quite a bit of literature out there that shows that heavy drinking is clearly associated with bad outcomes. Now, people will debate about light drinking or moderate drinking. And the definitions of that kind of depend on what study you're looking at. But in general, alcohol is not good for us, particularly in large amounts. Some people argue that being a teetotaler is not as good as just occasionally having a glass of wine here and there. I think that's very controversial. I personally almost never drink. I might have a glass of wine a few times a year. I just, it impacts my ability to perform well as an athlete. It doesn't do anything beneficial for me personally, and I think a lot of people, alcohol has ruined their life or wrecked their life in many ways. I mean, there's a lot of people out there that not only is high amounts of alcohol damaging them physically, but it's also leading to destruction in their relationships in their life, losing jobs, losing relationships, making poor decisions across the board. So giving up alcohol for many people was one of the top things that they did. The number 2 thing that people said they did was to adopt either a ketogenic or a carnivore diet. Now, realize that my audience, a lot of people that follow me have done that, and so that may skew that heavily. But I think that a lot of people find that low-carb diets are very beneficial for them, particularly for people that are already sick. There's thousands of papers on ketogenic diets showing that they improve a number of aspects throughout their health. Obviously, carnivore diets have not been studied to the extent that ketogenic diets have, but again, the low-carb spectrum basically encompasses, a whole bunch of, things, anything from a low-carb diet to a fully carnivorous diet. And in my experience, a carnivore diet may be one of the most powerful health interventions there is for a number of conditions. It is, the number of people that have reported, reversing disease, curing disease, coming off medications, improving all aspects of their life is enormous. I can't even begin to count how many people have been impacted positively by these types of diets. Okay, the number one thing, somewhat controversial, and it is something that I have to be careful on how I mention this, because the number one thing that people said that they did, or health decision that they made that had the greatest impact on their health, was basically avoiding a certain type of mandatory injection therapy that was mandated over the last few years. And you guys probably watching understand what I'm talking about. I'm trying not to get my YouTube video, de-algorithm or whatever. But anyway, avoiding certain types of injections or certain types of shots was seen by the most people as the most important health decision they made. Now, again, you can argue that a number of different ways, but that's what the responses are. I'm just sharing what the people said. In my view, again, I think there's some very important things we can do with regard to health, and I think the biggest ones, in my opinion, again, this is my opinion and based on my experience, and some of these things that weren't touched on. I think nutrition is right up there. I think exercise is up there. I think sleep, which was not mentioned in the top 8, but some people did mention it, is incredibly important. I also think that management of stress, and then finally circadian biology. I think those things are if I were to say these are the top 5 things you can do to get healthy, these are my areas where focus would be. And my personal favorite is exercise. I know a lot of people will disagree with that, but that is where I think you can make some of the most gains. Okay, one last thing. If you guys are looking for someone to help you get healthier, to implement some of these things we talked about, provide accountability, motivation, daily feedback, somebody's going to keep you on track, check out what we're doing at Revero. Our physicians are trained in this stuff. They want to get to the root cause. Their goal is to get you off medications, not to just stick you on them permanently. Our healthcare team is going to give you, a tremendous amount of support to help you be successful. And plus, I get to meet, the folks that are part of Revero. I look forward very much talking to our Revero patients. Let me know what you think about these top 8. Do you agree? Do you disagree? What has been your biggest positive healthcare decision that you've made in your life? I'll be looking forward to see what happens in the comments. Y'all take care.